My name is Cal Johnson, and I'm Associate Professor of Psychology at Lincoln University in Jefferson City, Missouri, and I'm here today to talk with you about seasonal affective depression. Seasonal affective depression is a specific form of depression that happens in approximately 0.5% to 5% of the population. It usually comes on in the late fall, after the fall equinox, when we begin to lose light at approximately 3 minutes per day from the fall equinox to the winter solstice on December 21st. In Missouri, on September 22nd, we have just over 12 hours of daylight every day, and by the time we get to December 21st, we've got just over 9 hours of daylight every day. It's believed that seasonal affective depression is caused in part because of a decrease in our brain's production of the hormone melatonin, which is important for other things that our body does, as the result of the loss of light. We're going to talk about several things that you can do to help yourself out if this is a condition that affects you. And the short list is the use of special lights, monitoring your diet, moderate exercise, possible use of melatonin supplements in the afternoon, and if it's really bothering you, the possible use of antidepressant medication. People who are affected by SAD can purchase lights with bulbs that produce light between 2,500 lux and 10,000 lux. Regular household bulbs are about 400 lux, which is not enough. There's a wide variety of these products, and the prescription is usually for 30 minutes under a 10,000 lux source early in the morning, or 2 hours under a 2,500 lux light source throughout the morning. Use the bulbs in the morning as opposed to in the afternoon, because if you use them in the afternoon, they can interfere with your sleep. And generally, people for whom this is a successful treatment report results in a few days or up to 2 weeks. But keep using them throughout the darker months. The second thing to think about is diet. This is a time of year when we have a lot of traditional comfort foods, baked potatoes, mashed potatoes, sweet potatoes, things with gravy, broccoli with cheese sauce, turkey, and these don't actually help us out so much with seasonal affective disorder. Turkey especially produces tryptophan, which affects melatonin and makes us drowsy. Drowsiness, excessive drowsiness, is something that is particular to the SAD form of depression. What you ought to do is find foods that are high in omega-3 fatty acids, which include such good things as salmon, mackerel, herring, sardines, olive oil, walnuts, flaxseed products, other fresh vegetables, and grass-fed beef. You can also throw in some cabbage and beets for folate, which is a B vitamin associated with depression resistance. And if you want to, you might check out some omega-3 supplements, but anytime you do something like that, please check with your medical professional before you make that decision. And if you want to, you can talk with your healthcare professional and see about getting some omega-3 fatty acid supplements. Number 3, exercise. Light to moderate aerobic exercise generally helps relieve depression by influencing our body's neurochemistry. Make sure you check out with your physician what kind of exercise program is appropriate for you and your general overall level of health. If your depressive symptoms are not seasonal affective depression, melatonin can make the depression worse and or cause depression. So if SAD is not your problem, melatonin might actually be bad for you. So check with your MD. Finally, if you have really problematic depressive symptoms, you might ask your medical professional about whether or not an antidepressant would be appropriate for you. They are relatively safe and effective for many individuals. However, if you choose this course, make sure that you report any worsening in your mood or increase in negative thoughts to your MD as soon as you notice them. I hope you find this information useful. Thank you for your kind attention.